Boy, this enlarged prostate situation is extremely common. As a man ages, 1 out of 2, that's 50%, will get an enlarged prostate. And this is called benign prostatic hyperplasia, which basically means an enlarged prostate. Now, before I get into what to do, because this is actually not a terribly complex problem if you understand it, and also there's a great solution, which I'm going to get to, but I want to just first differentiate what is the difference between BPH and cancer of the prostate. Are they similar? They're not too similar. In fact, they're pretty different. In cancer, you have these normal cells that then get damaged, specifically the mitochondria, and then they switch over to cancer cells, okay? And so with prostate cancer, that can spread through the body and it can kill you. It's very deadly. But with BPH, it's benign, which means it's not going to spread. It's not going to turn into cancer. It is not deadly. Now, with the symptoms of prostate cancer, you're going to get blood in the urine. You're going to get blood in the semen. You're going to have painful urination. You're going to have a difficult time with an erection. You may have pain with ejaculation. And so the symptoms are very different than BPH, where really this involves just the urinary tract mostly. You're going to get up to the night and want to urinate. You may have the urge to urinate but can't urinate, or you can't fully eliminate the bladder. So it's a bit incomplete. So with BPH, you just have a lot of different urination issues simply because the prostate is a gland and it wraps around the urethra, which is a little tube from your urinary bladder that comes out through your penis. And as the prostate enlarges, it obstructs the tube and you're not able to fully eliminate freely all the urine that's supposed to come out through the urinary bladder. So you're going to start and stop and start and stop and have dribbling and all sorts of issues. But the prostate should only be the size of a walnut, but it can actually get quite large. Now, with the prostate cancer, a big question is, will phytonutrients, specifically phytoestrogens, make things worse? There are certain compounds in herbs and vegetables that mimic estrogens. Okay, they're called phytoestrogens. And we know estrogen dominance in general can cause cancer in women, breast cancer, and also men as well. And a lot of the chemicals in the environment mimic estrogen, like the pesticides, insecticides, herbicides, fungicides, heavy metals. They're all considered estrogen disruptors or endocrine disruptors. But when we get to plant-based estrogens like phytoestrogens, there's a couple things you need to know. With phytoestrogens, you can prevent prostate cancer. You can slow down the progression if you have prostate cancer in the early stages. But if you're in a stage 3 or 4 or more, you may want to hesitate because there is some data that these phytoestrogens can actually make things worse. But I want to make a side note. The studies that I read on this were relating to castrated males. So if someone's castrated and they have advanced stages of cancer, they should not consume any phytoestrogens, even in small amounts, because it can make things worse. However, the purpose of this video is to focus more on enlarged prostate. So let's talk about that. So there's 2 main theories about why men develop a benign prostatic hyperplasia. And based on all the data that I've read, I think both of these theories are true and they both work together. The first theory has to do with as a man ages, okay, their testosterone goes down. And both men and women have both testosterone and estrogen. And so as a man ages, as their testosterone goes down, their estrogen goes up in relationship. So they have this ratio of lowered testosterone and higher estrogen. That's what occurs with aging. And if anything can be said about BPH, it is that it's involved with aging, factors of aging. So number 1, we have lower testosterone and higher levels of estrogen. And estrogen makes things grow, especially the prostate. Estrogen also can cause your pituitary to trigger another hormone called prolactin that can also enlarge the prostate. As one ages, many times they gain more weight, they have more fat, and the more fat you have, the more estrogen you're going to have too, because there's a certain enzyme that will convert your testosterone to estrogen. And that enzyme is called aromatase. And this happens in both men and women. And if your liver's in damage, let's say it's inflamed, let's say you have a fatty liver or you have cirrhosis, scar tissue of the liver, you're going to generate more estrogen. And I'm sorry to have to tell you this if you like to drink beer, but alcohol, especially beer, will affect the liver in that you're going to raise your estrogen levels a lot higher than your testosterone. So alcohol in general, lower your testosterone and raise your estrogen. Okay, the other thing that I want to mention, and this is important to understand, there's 3 types of estrogen, okay? You got estrogen 1, 2, and 3. And these estrogens out there, they kind of connect to these little receptors, okay, in different parts of the body. It's only the estrogen 2 that can enlarge the prostate, not estrogen 1 or estrogen 3. And all those phytoestrogens, those plant-based compounds that affect estrogen, only affect estrogen number 1, not 2, not 3. So phytoestrogens do not enlarge the prostate. However, they do attempt to go into the receptors in estrogen 2 and end up blocking them. So other types of estrogen cannot create the effect. So they help lower the estrogen 2, which indirectly protects you against this prostate enlargement problem. So when you hear all this information out there about plant-based estrogens enlarging your prostate, it's absolutely not true. It's not going to happen. All right, the second part of this puzzle involves testosterone. As your testosterone decreases, you also have a powerful form of testosterone called DHT, okay? That increases. DHT is responsible for hair loss. It's also responsible for the enlargement of your prostate. So as you age, you have lower testosterone and higher levels of DHT. Those people that have genetic problems where they can't make DHT never develop an enlarged prostate. So the question is, what's making more of its DHT? Well, this relates to another enzyme. Okay, the name of that enzyme is called 5-alpha reductase. And if you have too much of that enzyme, you're going to get too much DHT, and that could potentially enlarge your prostate. All right, so now that you know both mechanisms, what can we do about it? Okay, well, the first strategy is to start consuming more phytoestrogens. Okay, that's going to help you. And there's a real common one called genistein that a lot of people take for an enlarged prostate. And genistein is a phytoestrogen that's in a lot of legumes. It's in a lot of different things. That can help with this enlarged prostate. The next thing is cruciferous vegetables. Kale, broccoli, Brussels sprouts, cabbage, all increase the amount of phytoestrogen in the body. So you should start eating those foods on a regular basis. They will not increase the estrogen number 2. They'll block it to prevent other things from entering into that receptor that can cause an enlarged prostate. Now, the next 2 strategies involving blocking those 2 enzymes. One of the enzymes called aromatase, and that's the one that converts testosterone into estrogen, okay? And that's in your fat cells, it's in other cells. And so you want to take aromatase inhibitors, okay? Now, certain medications for the prostate do it synthetically. I recommend doing the natural versions of that. And believe it or not, I released a video recently by blending the entire lemon, the lemon peel, the white part, the seeds, everything, every morning with some stevia, and you blend it in some water and drink that. Apparently citrus peels, okay, from lemons and limes can act as an aromatase inhibitor. So if you haven't seen that video, I put it down below. It's a real easy thing to do, and it'll also give you a lot of vitamin C and other things as well. Another really powerful aromatase inhibitor is stinging nettle root. I like stinging nettle root a lot because it's a great anti-inflammatory as well. So if you have arthritis, definitely want to take that one. And then the other one is DIM. Okay, DIM is a concentrated cruciferous compound that you can take as a supplement and greatly help in the balance of excessive amounts of estrogen. And then the third category is to block the other enzyme called 5-alpha reductase. And so you want to inhibit that enzyme. And that would be by taking saw palmetto, which you probably already heard that's good for the prostate. Also, pumpkin seeds will help reduce that enzyme. And green tea will reduce that enzyme. And zinc will help reduce that enzyme. So now you know why it works. But on the flip side, you also want to avoid certain things too. High levels of insulin can act as a growth factor for your prostate. So you definitely need to go low carb, as well as doing intermittent fasting. I would also avoid dairy products because dairy has some estrogenic compounds. And you may have already connected the dots between times that you, for supper, had more dairy, and then that night you're getting up having more urination problems or having problems voiding. So dairy is a factor. Then we have alcohol. Okay, if you want a good alternative for alcohol, I would try kombucha tea. It's similar in texture to beer, and it gives you a nice relaxation effect. Now, the other point I want to bring up is plastics. I've done a whole video on this, but unfortunately, the plastics in our environment are mimicking estrogen and creating some serious problems, especially with an enlarged prostate. An average person in the U.S. consumes the amount of nanoplastics that would equal the size of a credit card. So I do have a video on that, and I put that down below as well. If you're drinking water and without a filter, like tap water, you're going to be getting a lot of compounds that mimic estrogen as well, especially those plastics. So you want to get a water filter for your house. And then you have the hormones in the foods, right? So if you're not consuming many organic foods and you eat out at a fast food restaurant, you're getting a lot of hormones that are coming from the animal products that are being mimicked from the pesticides, herbicides, fungicides, things like that. Now, as a really simple thing that you can do right off the bat is to start including whole lemons, okay, in the blender with water every time you get up in the morning. If you haven't seen that video, I'm going to put it up